بسم الله الرحمن الرحيم. وعصر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالصبر. Today we'll speak about SBAH standards for infection control. Last update 2023. Before we speak about SBAH, I want to speak about what is SBAH. It is Saudi Central Board for Accreditation of Healthcare Institutes. This is the abbreviation of SBAH. It is the official agency authorized to grant accreditation certificates to all governmental and private healthcare. This is non-profit agency. We expect their visits maybe next month or at the end of this month. So we should prepare ourselves. And staff readiness, so we should be ready. Don't be afraid and remain calm and friendly. Introduce yourself. What is your job title? What tasks are assigned to you? They will ask some questions and we prepare questions and answers for BCI. Are you aware of Moassad Infection Prevention Control Program? Yes. Go to intranet BBG BCI 01. It is a comprehensive program involving patients, staff, visitors, and environment. Who is responsible about infection control in the hospital? Infection prevention and control is everybody's responsibility. Who is IBC physician and IBC nurse? Dr. Mahmoud, IBC physician. Miss Maria Christine, she is IBC nurse. What is the healthcare associated infection formerly known as nosocomial infection? Infection which is not present or incubating at the time of admission, but became evident after 2 calendar days of admissions. This is meaning at the 3rd day. So we can say after 2 calendar days or on the 3rd day of admission. We have we make surveillance for surgery site infection, VAB, ventilator associated pneumonia, CLABSI, central line associated bloodstream infection, and last is CAUTI, castor associated urinary tract infection. What is the most important activity for healthcare workers to reduce the risk or prevent the spread of healthcare associated infection? Sure, the foundation is hand hygiene. What are the 2 ways used to do hand hygiene? We have hand washing using water and soap, and alcohol-based hand rub using alcohol. Hand washing consuming from 40 to 60 seconds. If hands are visibly soiled, we should do hand washing. Or when we are dealing with patients with Clostridium difficile spore-forming bacteria, now we mandatory make hand washing because alcohol has low disinfection power, so it will not penetrate spores of spore-forming bacteria like Clostridium difficile. So the only method we should do hand washing. Alcohol-based hand rub, we do it if our hand is not visibly soiled. It consuming time from 20 to 30 seconds. Alcohol-based hand rub, we prefer to use alcohol because it is available in each place and it has antimicrobial power and it consuming less time. But it should, your hand should be not visibly soiled. And after using alcohol-based hand rub, after 4 to 5 times using it, you should separate by 1 hand washing to remove the built-up bacteria which is killed by alcohol and also the remaining amount of glycerin in your hand because our alcohol-based hand rub including glycerin. So after 4 to 5 times alcohol hand rub, we should separate by 1 hand washing. What is the correct way to do hand hygiene? We have 6 steps, as we know. Bulb to bulb. First, you should remove all rings or jewelries and your watch. First, you will take a liquid amount. I don't know it's clear or no. Bulb to bulb, 3 to 5 times. Bulb to dorsum of the hand with interlacing and vice versa. Again, interlacing from the front to kill microorganisms also from the front. Interlocking and the butterfly movement from up to down rotationally with thumb, up to down rotationally to thumb. After that, between nails and these grooves. This is the last step. It consumes from 20 to 30 seconds. In hand washing, also the process of friction take from 20 to 30 seconds, but we add another 20 to 30 seconds for rinsing your hand and drying your hand by tissue. So in hand washing, it will consume all the process 40 to 60 seconds. When you should do hand hygiene, we have 5 moments for hand hygiene. Before and after touching the patient or his surrounding, before aseptic technique, and after body fluid exposure risk. As we see, we have here this circle, inside it patient zone, outside healthcare zone. My rule to prevent healthcare infection coming from healthcare zone to patient zone, or infection coming from patient zone outside to healthcare zone, which is called exogenous infection. It will be through before touching the patient, after touching the patient or his surroundings. We have something called endogenous infection from patient to himself. To prevent endogenous infection, we should make hand hygiene before clean or aseptic procedure or after body fluid exposure risk, just risk. We are dealing with microscopic microorganisms. You should not wait until you see your hand is visibly soiled. Just in risk for body fluid exposure, you should make hand hygiene. This is the 5 moments. When you should use alcohol-based hand rub before and after contact with patients, equipments, and environmental surfaces around the patient, and when hands are not visibly soiled. What do you mean by standard precautions? Standard precautions are a set of protective measures designed to prevent contact with body fluids of any other person or any contaminated articles. It is designed for the care of all patients without regard to known or suspected diagnosis. So it is for all patients all the time. As we said before, this is the foundation of infection control. And the first strategy is for infection control is standard precaution. Second strategy is isolation transmission precaution. Third strategy is empiric isolation transmission precaution. We isolate the patient until his lab result come and confirm the case. And the fourth strategy and the last strategy is a protective environment or reverse isolation. And we use this strategy with oncology patient and hematopoietic stem cell transplantation. We put them in positive pressure room. What is the standard precaution? We start with the patient by doing hand hygiene. After hand hygiene, we use personal protective equipment like gloves, mask, goggles, face shield, and gowns according to the risk of procedures that we will use with the patient. And during dealing with the patient, we will use aseptic technique. Clean touch clean, sterile touch sterile, preparation for patient by making cleaning and disinfection for his skin before any insertion, for cannula or any surgery, cut like this. And after that, we will do proper linen management. We have yellow hampers for contaminated linens with body fluid and white one for soil. And also we have environmental cleaning and disinfection. And after we finish with the patient, sure we have some waste. So we will make waste segregation, and we have hazardous medical waste and non-hazardous medical waste. And the pathological or body parts, sharps, chemicals, fluid waste, enclosed yellow container, pharmaceutical yellow containers, and we will speak about it now. As we see, this table is spread in all departments: general waste, black bag, the following items that will not release drip, blood, or other potentially infectious material in a liquid or semi-liquid state if squeezed. So BBEs, IV bottles, IV tubing without blood or chemotherapy, dabbers, food and food wrappers, paper and waste towels. So the key word is this item will not release drip, blood, or other potentially infectious material in liquid or semi-liquid state if squeezed. What about infectious waste, which we will put in yellow bag? Items contaminated. What is the meaning of contaminated? Dripping or soaked with blood or body fluids, like blood products, tubing bags, blood gas analyzers, CVZs, pulmonary cotton, radial artery, caster tubing, all these things that can dripping blood or body fluids during transportation for our waste. We have something called the chemical waste. These waste are flammable, corrosive, and we put in containers and we discard it after reaching 3/4 of this container, rigid container. Pharmaceutical waste like expired medication remnants, ointments, eye drops. Pathologic waste, we put it in red bags. All tissues, organ removed during surgery, placenta or fetus. Sharps, we have sharp container. We put in it needle, scalpels, broken vials and ampoules, sharp part of the IV tubing, blades. We have a special container for tooth with amalgam. It's called amalgam container. You will find it in dental. This signage you will find in each department. It summarizes what we speak about it in hazardous and non-hazardous medical waste, and what should be in black bag and blue bag. What are the type of isolation transmission precautions? As I said, this is the second strategy, is isolation transmission precaution. We have three types of isolation transmission precaution. You will find it clear in BCI number 11. First one is airborne isolation precaution like tuberculosis, measles, varicella. You mandatory to use N95 mask when you enter to the patient, and we place the patient in negative pressure isolation room. You will find signage outside with color code blue color. Droplet isolation precaution like meningitis, mumps, pertussis, influenza. You will use surgical mask is needed when you are near to the patient by 3 feet. You will find color-coded signage outside the patient door with color red. Contact isolation precautions, MDROs, norovirus, rotavirus, herpes, and that you should have gloves and gown before enter to the patient. And you will find signage outside with color-coded green. What is the negative air pressure isolation rooms? We have 19 negative air pressure isolation rooms for isolation of patients with airborne transmitted disease. The air inside the room is not allowed to go outside the corridors. Air change per hour more than 12 recorded every 1 month by engineering, and HEPA filters changed every 6 months. Engineering record is very important to keep the workplace safe. How do you wear PPE for isolation room? We have sequence for donning and doffing PPE. Before we donning PPE, personal protective equipment, we make hand hygiene and start to wearing gown. After gown, mask. After mask, put face shield. At last, gloves. After I finish with the patient, I will removing my PPE. First thing I will remove sure is gloves, the most contaminated thing because I touched the patient by it. After that, I mandatory to make hand hygiene. After that, I will remove goggle or face shield and removing the gown, and I should separate after removing gown by one hand hygiene. At last, I will remove mask or respirator if I dealing with patient in airborne isolation room. Removing N95 should be outside the room of the patient at anteroom. After removing high efficient mask or surgical mask, you should make again hand hygiene. So we have 3 hand hygiene in removing PPE. After removing the gloves, after removing gown, and after removing mask or respirator. What are the precautions required during isolation patient transportation? First, communicate with the receiving department to inform them about the type of isolation precautions for the patient. Wear PPE according to type of isolation. Send isolation precaution card with patient to the receiving unit or hospital. Put surgical mask to patient who's under airborne or droplet isolation precaution to contain sneezing or cough droplets during transportation. If the patient was under contact isolation, you will contain the patient by giving him gown and contain him by clean linen, and you as healthcare worker, you will wear only gloves. If the patient under droplet isolation or airborne, just give the patient mask, and now no need for you to wear anything. But if the patient can't tolerate mask, so now mandatory you should wear surgical mask if the patient was under droplet isolation, and N95 if the patient was under airborne isolation. Are you aware of needle stick or sharp injury, blood and body fluids exposure policy and reporting protocols? Sure. In case of needle stick injury or sharp injury or body fluid spilling, what you will do? First, don't be panic. First thing. And second, remove the gloves. Not allowed to dealing with any sharp thing that can cause for you injury without using the gloves. So first, don't be panic. Remove the gloves. After that, discard the sharp items in sharp safety box. After that, go directly and wash your hand by water and soap only. Don't use betadine, don't use chlorhexidine. It will make irritation and increase blood supply to the area of injury and can cause increase the opportunity of infection. So just water and soap, and never ever make squeezing. Just keep your hand in the direction of gravity like this and let the blood go outside from your body, from the side of injury, free. Don't squeeze. Then inform you finished, you can dry your hand, and after that, now you can put the betadine or chlorhexidine to make disinfection. And after that, you will contain the place by sterile juice or something impermeable to fluid. If you want to continue the procedure, wear another gloves and continue the procedure. If you finished, خلاص, go directly to ER or to Employee Health Clinic to make post-exposure prophylaxis. And put in your mind, you will do serology for you as exposed and for the source, the patient who is the source of needle stick injury. And sure, you will make OVR and inform BCI department by needle stick injury through the form of the needle stick injury form. How do you prevent sharp injury? Never recap, not accepted. If you mandatory to do recapping, use one hand scope technique. Discard directly into sharp box as one unit. Don't separate the needle from syringe. All sharps should be discarded in sharp box. How are the container for sharp is disposed of? When the sharp container are 3/4 full or bad smell or after 1 week. Until now, our policy is after 1 week. Nursing staff seals them and they are taken to a secured medical waste room until collection time. Who is the responsible for disposing them? Housekeeping services are the one responsible for disposing sharp containers. What is the color coded used for infectious waste? A yellow bag with biohazards. How to protect yourself from infection? This is question. Following the infection control policies and applying standard precautions to all patients by doing proper hand hygiene, wearing personal protective equipment if needed, and the proper disposal of sharps or contaminated wastes. Lastly, by receiving vaccination. What are the immunizations you received? We all received after doing serology. If the serology gave negative, we give you hepatitis B vaccine, seasonal influenza vaccine, MMR, varicella, annual BBD test. We do it to monitor the serology conversion for our staff. Did have vaccine. What is aseptic technique? It is very important. It's very questions. There is a written policy and procedure for clean and aseptic technique. This policy is BCI 57. It's very important. We all should read it. Including separate clean area is available and maintained for preparation of medication away from patient's treatment area. Not allowed for preparing any medication besides the patient. A peripheral venous catheter is properly fixed with a clearly written date of insertion and to reduce risk of infection and phlebitis. It is replaced if still needed as follows. In adult, not replaced more frequently than every 72 to 96 hours. In children, it is replaced only when clinically indicated. So it is important to write the date of insertion to determine when I should replace it, especially in ER. ER has other special policy. If the patient coming from ER, we should change the cannula within 24 hours from admission. Because they expect staff didn't adhere to proper aseptic technique during insertion. So they decrease the time of replacement. Preparation and dilution of medication are only done by ready-made single-dose sterile solution. not to use 500 milli bottle and start to take from it by syringe and make dilutions. It is not accepted. Single dose or single use vials is used for a single procedure injection in a single patient, and it is not stored for future use even for the same patient. Needles and syringes, including pre-filled syringes and containers holders, are used for a single procedure injection. Cartridge devices such as insulin pens are used for only one patient. It is very important. You should write the name of the patient and the date of opening, and not to use after 28 days. Supplies are brought to patient's care area only when needed. It's very important, especially in the ICU and the ICUs. And after patient discharge, all remaining single-use items are discarded. Very critical. While reusable ones are sent to CSSD, our sterilization department, for reprocessing even unused item with intact original wrap. Just it became in the patient zone, now mandatory to be discarded or reprocessed according to the type of it. So from the start, supplies are brought to patient's care area only when needed. If multi-dose vial is used for more than one patient, they should only be kept and accessed in a dedicated clean medication preparation area away from immediate patient treatment area. The self-sealed rubber cap of a medication vial or an intravenous solution bottle is disinfectant with approved antiseptic wipes, like alcohol wipes, prior to any access. Very important. We deal with it as the skin of the patient. IV sets, including secondary sets and add-on devices that are continually used to infuse crystalloid solution like hypotonic, isotonic, or hypertonic solutions are replaced at least every 7 days, but not more frequently than 96-hour intervals. We choose here in our hospital 96-hour interval to remove it with cannula. IV sets that are used to administer blood-brain lipid emulsions or dextrose amino acid TBN solution are replaced within 24 hours of initiating the infusion. For ventilated patients, it is important in ICUs. Ventilation circuit is only changed when feasibly soiled or mechanically malfunction. Sterile solutions are used in nebulizers, humidifier, or any aerosol generating system and changed between patients. Very important to use sterile solution, not from the water tap. And every 24 hours for the same patient, unless the manufacturer of ready-made sterile solution specific different dates. And the hygiene practiced before breast milk expression. And sterile container is used for breast milk collection and preservation. Healthcare worker wears mask during insertion of catheter or injection into spinal or epidural space. It prevents meningitis. What are the bundles? This is questions, and this question is very important. A group of best practice to prevent certain healthcare acquired infection like SSI bundle, VAP bundle, CLABSI, County, and MDROs. Care bundle is a set of interventions that when used together significantly improve patient outcome. So the bundle is all or none. We should do all the bundle one time, not to make one component and let other. It is not accepted. SSI prevention bundle, skin preparation, use of clipper, don't shaving to not make irritation, antiseptic skin scrub. If you use betadine or chlorhexidine, you should remain in it for at least 2 minutes to take the antimicrobial power from it. Normothermia, to keep patient normothermia and patient glycemic control before and after the surgery within 24 hours. Prophylactic antibiotic, you should give before the surgery by 24 hours, by 1 hour, and to discontinue prophylactic antibiotic within 24 hours from the surgery. If you increase the time more than 24 hours, it will be considered as treatment, not prophylactic. For Cauti bundle, castor-associated urinary tract infection, before we start insertion, you mandatory to make hand washing, use of aseptic technique, timidity of a flu, keep it back below the bladder level to prevent irrigation of the urine to the urinary bladder, cleaning of exit portal, and castor daily care. Epilepsy bundle, central line associated bloodstream infection, hand hygiene, maximum barrier precaution during insertion, you wear overhead gown, eye goggle, mask, gloves, stride, so maximum barrier precaution during insertion, hand hygiene will be scrub hand hygiene, selecting the proper vein, change of dressing. If it was transparent like this, you should write the date of insertion or changing, and you will change dressing after 7 days. If it was not transparent like this, we change the dressing after 2 days. VAP bundle, elevation of head of the bed, daily sedation and vacation and readiness of patient to extubate, peptic ulcer prophylaxis, deep vein thrombosis prophylaxis, and daily oral care with chlorhexidine to prevent infection for the patient. Who is the Employee Health Clinic physician? We have Dr. Iman Abdelkader to manage and follow up all employees, who is responsible to take nasopharyngeal swab for suspected cases of MERS-CoV or COVID-19, trained, competent person, nurse or physician. Process of isolation of patient, treating physician is the one responsible for initiating isolation. Infection control might help if physician requests more information about the type of isolation and the availability of isolation room. Discontinue isolation depends upon the infectious disease itself. Changing curtain policy, it is Landry 08. Ward unit, frequency of washing curtains after patient discharge or if necessary. Critical area, washing of curtain is done every 1 week and after patient discharge and if necessary. OBD sealings every month and if necessary. Type of isolation, revised BPG-PCI level, contact precaution like MDROs, droplet precautions like influenza, whooping cough, pertussis, meningococcal infections. Airborne precaution, pulmonary TB, chickenpox, measles, disseminated herpes zoster, which is shingles, with multiple eruptions. Admission of isolated cases from ER or OBD, all suspected MERS-CoV, COVID-19 should be transferred to isolation room in ER to be examined and investigated there with nasopharyngeal swabbing. done by competent nurse or privileged physician. Use surgical mask for patient during transportation, as we said, for droplet and airborne cases. Use the shortest way toward. Limit movement of the patient. Put transportation signage while transporting the patient on the chair or bed to be obvious to all staff. Inform receiving ward to prepare themselves to receiving the patient. Isolation room cleaning, we have policies. This is BBG housekeeping 20. Use sodium hypochlorite at high level disinfection 5,000 parts per million concentration. How to deal with body fluid spillage on the surface. This is BCI number 29. Contain the site by the tissue. Call the housekeeping to deal, and he will do the following. Put the signs. Bring the blood spill kits from the housekeeping room. Wear proper PPE, apron or gown, mask, goggles, gloves. Apply perceptic granules, including chlorine product, to area of spills and wait for 2 minutes to kill microorganisms and absorb the blood or fluids. Use disposable towel or disposable cloth to contain and remove all the spilled blood. Carefully whip up the spill with paper towel, cleaning clothes in the color-coded yellow plastic infectious waste bag with medical waste sticker and send waste to hazardous room. The area is then rinsed with wet disposable towel. Remove disposable gloves, goggles, shoe cover, plastic apron, and wash hands with antiseptic soap. We have some policies. Some policies very important. This is the last slide, by the way. We should be careful with definitions of healthcare associated infection, BCI 02. It is very important, especially for all doctors and nurses in ICUs and OR. And the hygiene policy, BCI number 15, very important. Standard precaution, BCI 12. Isolation transmission precaution, BCI 11, very important. Sharp and needle stick injury, 13. Blood and body fluid exposure, BCI 19. Occupational healthy staff screening and immunization. It is very important for your immunization, screening done for you, work restriction, and exposure for infectious disease, what you should do. So BCI 18, very important. And spillage of the blood, BCI 29. So thank you, we can do it. And I think you are ready to pass the and best regards and good luck. Now